What is glaucoma?
Hello, I'm Dr. William Layden, an ophthalmologist with a subspecialty interest in glaucoma. Glaucoma is a disease that encompasses all age groups, both males and females. It's a disease that has many ramifications in terms of loss of sight and blindness throughout the world. We are just beginning to understand some of the problems with this disease, but let me first of all go through what the disease process is. Basically, it's a problem where the pressure inside the eye builds up because the fluid that normally circulates within the eye can't get out. In other words, the pumping mechanism is fine, but the drainage mechanism is impaired. As a result of this, the pressure inside the eye, which we all know is hollow, goes up to a critical point and starts pressing on the weakest part of the eye, which happens to be the optic nerve. The optic nerve is the cable as such that connects the eye to the brain and transmits the image to the brain and causes sight to be formed. As a result of this, the nerve atrophies both from compression and from loss of blood, and the optic nerve becomes destroyed by the pressure of glaucoma. There are a variety of types of glaucoma, many of which are very unique to the type of injury or the type of congenital anomaly that develops in the eye. However, today I think we'll discuss the most common form, which is open-angle glaucoma. There are probably about 2.5 million people in the United States that are blind from glaucoma, and unfortunately there's probably another 500,000 that don't even know they have it. It's a silent disease with no signs or symptoms because the pressure rises very gradually. As a result of this process, the optic nerve slowly dies and your visual field, that is your side vision out here, constricts into a very small tunnel of vision, and ultimately that tunnel of vision is gone and you lose all useful sight.
Let us take a closer look to see what glaucoma is. In a normal eye, the fluid, which is constantly being produced, drains out and is reabsorbed into the bloodstream, leaving a balance of pressure within the eye. With glaucoma, the circulation of the fluid is disrupted, leading to a blockage of fluid inside the eye. This blockage of fluid stops the process of reabsorption of the eye fluid, leading to a high-pressure rise within the eye. This high pressure can ultimately affect the optic nerve, which connects the eye to the brain, eventually causing blindness. How is glaucoma diagnosed?
Fortunately, now that we know more about the disease process, we know how to treat it. First of all, we have to detect it. The most common detection process is by a simple eye examination, where we measure your vision, your pressure by special instruments inside the eye, look at the angle, that is where the tubes where the fluid leaves from the eye, examine the side vision of the eye, and ultimately look at the optic nerve with special lights and lenses. When we put this all together, we can form a conclusion as to whether you have glaucoma or not. If you have glaucoma and it's diagnosed, in the early stage, prevention of blindness is the most important thing. Restoration of blindness is impossible in the late stage because once the nerve is destroyed, it's like the brain, it's not regenerated.
How is glaucoma treated?
There are a variety of treatment modalities available to us today. We usually start with drops. There are different kinds of drops that can be used separately or in concert with each other to reduce the pressure inside the eye. There are also lasers that we use today to treat glaucoma. Many of these lasers work by allowing the fluid to leave the eye more rapidly. Then finally, if lasers and/or drops don't work, to halt the progression of the disease, we have the options of surgery. One of the more exciting approaches that we have for the treatment of glaucoma is the development of valves. Valves are usually plastic inserts that we put into the eye. They are basically done as an outpatient under local anesthesia in about the same time that it takes to do a routine cataract operation. The valve actually sits outside the eye. The plate of the valve collects the fluid between the muscles of the eye, and the tube of the valve goes inside the eye where the fluid buildup is. The valve is then covered by the skin of the eye called the conjunctiva and tenons, and the fluid then goes through the valve, to the chamber of the valve, into the plate of the valve we call the reservoir, and is then collected by the blood vessels of the tissue around the eye and returned to your bloodstream. The reason why valves are exciting is because they treat forms of glaucoma that formerly were disastrous in terms of restoration of vision.
How does the Ahmed Glaucoma Valve work?
In this model eye, we see a valve as it's implanted in the regular eye. These red stripes here represent the muscles that move the eye up and down, back and forth. This area here represents the cornea with the pupil behind it. The valve actually is not placed inside the eye, but on the surface of the eye between adjacent muscles. It's sutured there, then the valve tube is placed inside the eye where the fluid is, into what we call the anterior chamber. Then the covering of the eye, called the conjunctiva tenons tissue, is sewn back over the valve so that the valve cannot be seen nor felt. The purpose of the valve is to take the increased fluid and allow it to exit from the eye through a chamber here and a collector plate. The fluid therefore goes through the chamber, collects underneath the skin of the eye, and returns to the body by the blood vessels that are on the skin of the eye. This particular valve is unique in as much as it has a chamber that allows the fluid to be regulated. Straight valves that do not have chambers sometimes have trouble, especially in the early postoperative period where the pressure goes from a high pressure to a very low pressure and the front part of the eye collapses. This causes great problems with swelling inside the eye, sometimes hemorrhage.
The Ahmed Glaucoma Valve consists of a very small plate with a unique valve system that regulates your eye pressure. Attached to the plate is a tube that drains the fluid out of the eye, thus reducing the eye pressure. Implant surgery immediately reduces the pressure in the eye by giving the fluid a means to drain out more efficiently. Because the glaucoma implant is a valve, it adjusts itself according to the fluid pressure in the eye. There is a precise control on the amount of fluid that is allowed to flow through it. This ensures that there is no excessive drainage from the eye, which can be a serious problem. The Ahmed Glaucoma Valve is the only implant available with a unique valve mechanism, which prevents the excessive drainage of fluid from the eye. The Ahmed Glaucoma Valve is the best solution against hypotony.
I'd like you to listen to some of my patients as they relate their experience with glaucoma in terms of control and diagnosis.
In my early 40s, when I got the long arm disease and I couldn't read the newspaper at a comfortable length anymore, went for a routine eye exam. And at that point, the pressure in the right eye was slightly elevated. In the left eye, the pressure was fine. But because there was a suspect of glaucoma, then I started using drops in both eyes. This continued for several years, but what would happen is in the right eye, after a certain length of time, the pressure would increase. So we would try a new medication. After another length of time, the pressure would increase again, try a different medication, and this just continued for several years. Then finally, one time, it was, I think, over a Labor Day weekend, it was just out of control almost. I felt it. Previous to that, I had not felt the pressure, but I could actually feel the pressure rising at that point. I think when I went to the doctor, it was probably real high 30s. And that was when I was then referred to a glaucoma specialist.
I had 2 implants, one in the left eye and one in the right. The one in the left one, I think that was did about three years ago. See, my left eye is not too good because I had what's called detached retina. Oh, that's way back in 1988. So that kind of, made my vision a little bad. But I could see out of it, not as good. So the doctor in Portugal that's recommended you to keep from losing the vision, completely losing. I had to have that. I had to put what's called a drain or whatever it is in there, left eye, and then so that kept it up a whole lot. So, other words, it's under control.
And then how about your right eye?
My right eye, that's when the doctor used to did everything they could because they, other words, to keep from going through the surgery with an implant. And then he told me he done did all he could do. See, I'm gonna have to have this implant in my right eye. See, if I don't, I will, in the long run, he said I might lose my right eye.
When I was 9, I was diagnosed with iritis. It's an inflammation of the eye. And over, the course of my life, up until 25, I used Predforte, a steroid drop, just, on occasion when the iritis flared up. And I had no problems with that. When I was 25, my eye started responding with the pressures going up. And at that point, I was diagnosed with glaucoma. I was having a lot of problems with my right eye at that time. It would flip from one eye to the next. So at one point, my doctor suggested surgery, and I went ahead and had it in the right eye. After the surgery, the right eye was fine. It was stable. I wasn't having any problems with the pressure elevating. And then my left eye started reacting to the steroid drops, exactly like my right eye. So at that point, I actually waited for the surgery, and I lost a little bit of vision in my left eye, and then I got the surgery, and it stabilized too.
How long is the recovery time after Ahmed Glaucoma Valve implantation?
The surgery was pretty quick, actually. They got me in and out, and then it was about probably a week after that my eyes started feeling normal again. My vision was pretty blurry for the first few days. And then that stabilized too after about a week.
And I'll say about 2 weeks I could see good and everything. But 2 weeks, 2.5 weeks, I'll say back to normal.
There was some bruising, and that took probably about a week before it went away. But I also teach, and I went right back to work within, not the next day after surgery, but the very next day. And the kids didn't even think anything about it. There was no problem. It wasn't like, ew, what happened to you? So they were fine.
How has the Ahmed Glaucoma Valve surgery affected your life?
I tried pills to help the pressure, but they did not do well for me. It made me very, very sleepy and tired. So this was much more conducive to the type of work that I do and how I need to be sharp, because when you're standing in front of 30 kids a day, you've got to be sharp completely.
Well, the valve surgery has stabilized my glaucoma so much so that it's, minimized any more loss of vision that would have occurred. So it's been great. If I had to do it all over again, I would.
It had a good impact on my life. Because now I can see a whole lot better. So now I don't actually have to wear glasses unless I have to. So I got my glasses in my pocket.
Would you recommend the Ahmed Glaucoma Valve surgery to other glaucoma patients?
I would recommend to anyone. It's nothing to be afraid of. Anyone. At my age, I went through it. I'm 75. I went through it. So I would recommend it to anyone.
Don't be afraid of it, because the alternative of having to deal with this pressure was just way more than I would want to ever deal with.
For me, and I think for a lot of people, if you're losing vision, it's going to be a no-brainer. It's either you do it or, you lose some vision, and that wasn't an option for me.
The reason why valves are exciting is because they treat forms of glaucoma that formerly were disastrous in terms of restoration of vision. They offer us a new horizon for the treatment of very difficult to control glaucomas. Valves are usually done in unique glaucomas and in people who have had traditional glaucoma surgery, like filtering operations, that have failed. There are probably about 2.5 million people in the United States that are blind from glaucoma, and unfortunately there's probably another 500,000 that don't even know they have it. It's a silent disease with no signs or symptoms because the pressure rises very gradually. Valve implants have really become very popular today because of the fact that they can treat types of glaucoma that the other surgery cannot treat. So we have really basically a variety of ways to prevent blindness from glaucoma. The most important thing for us to do today is to become aware of it, diagnose it, and have the patient treated appropriately to prevent ultimate blindness. Thank you.